stigma. There's still a lot that needs to be done. Cultural safety, anti-racism, more community leaders, Black, Asian, Indigenous, stepping up. We need increased visibility and representation. Especially for our Black community, it's important for us healthcare professionals to utilize compassionate language and empathetic approach and respectfully disclose dementia diagnosis. And what it essentially means is respecting and understanding people's culture, their values, their concerns, their perception, and integrating that in the management process. It goes a long way to improve the, to foster the health outcome and also the stimulating engagement in the dementia management process. Going to the other question in terms of mistrust in the Black community, yes, I acknowledge that. So that mistrust is due to historical mistrust, is rooted in colonization and exploitation, and that is where increased visibility and representation of Black physicians is important, because we have to, be advocates for our Black community, and that when they see themselves in us, that stimulates engagement, that can build trust, and it can, prompt them early intervention and treatment, and possibly involved in research as well. So yes, so I am optimistic about, where the healthcare is headed, in terms of reducing stigma and, promoting diversity, inclusion, and equity. However, more still needs to be done. If we look at the faces of dementia, like I said, they represent ethnicity, race, culture, and class, right? And these different characteristics can simultaneously occur, right? And when they simultaneously occur, they can intersect and shape an individual's identity. And shaping that individual's identity, it can impact health-seeking behavior. And if you bring those characteristics in a broad, like a spectrum of, or ring of power balance, you can see how those characteristics can be seen to be a privilege or oppression. And when you connect them to healthcare, social determinants of health, you can see how that can exacerbate health inequalities. So we need more culturally competent and diverse healthcare professionals in the healthcare setting.